million pharmacists and pharma scientists across the globe. It is a pleasure to invite you, Ms. Gharat. Her main interest is to improve retail pharmacy practice, but also to involve pharmacists in the improvement of community health. And she actually involves pharmacy students in a lot of different research programs on different aspects, different public health activities. I would now like to call upon Mr. Manoj Pardesi, who is the General Secretary for National Coalition of People Living with HIV in India. He's the founding member of the National Council of People Living with HIV, and he's worked as a national coordinator for the International Treatment Preparedness Coalition in India, and also with the UNDP Regional Office for South Asia, where he helped start a staff group for people living with HIV within the United Nations system. So he has about 18 years of experience working in this area, collectivizing people living with HIV, but he's also worked with government, non-government, bilateral funding agencies to facilitate policy and advocate for legal change to protect rights and meet PLHIV needs. Welcome, Mr. Manoj. I would now like to call upon Ms. Viveka Roy Chowdhary, who is the editor of Express Pharma and Express Healthcare from the Indian Express Group. She is a microbiologist by training, but is now a pharma and healthcare journalist. She has about 2 decades of experience working with different pharmaceutical journals, and currently the editor of Express Pharma, which is today India's leading business fortnightly for the pharmaceutical industry. And she also has degrees in mass communications, and she brings in the important perspective of media to this discussion today. And finally, last but not least, we have my colleague and friend, Dr. Somdatta Karak, who is a science communicator, and she's passionate about making science available to young people and general public. And she leads the science communication and public outreach at the Central Government Institute Center for Cellular and Molecular Biology in Hyderabad. She also co-leads Superheroes Against Superbugs, an educational and public engagement initiative on AMR. And she also co-founded and co-leads Sci City Hyderabad, which is an initiative to bring science to the cultural conversations of Hyderabad. She's a neuroscientist by training and is passionate about bringing science conversations and conversations around health to society. So we have some very, very diverse panelists today, and I hand over to you, Dr. Ratna, to take the discussion forward. Microphone.
So, Dr. Ponnari will join us here.
Okay. I'm happy just.
So, good afternoon, everyone, and thank you for joining us for this session today. The session's theme or session title is Debugging AMR from Awareness to Action in Everyday Life. So the key word is everyday life, and the theme is rallying all hands on deck to beat AMR. And as Dr. Ponnari said in her introductory statement before she introduced all the panelists, most often conversations around AMR are with technical specialists, doctors or healthcare providers, though AMR goes beyond the hospitals or the brick and mortar institutes. And we know that in the context of our country, where people tend to buy antibiotics without prescriptions, there is a lot that needs to be done on consumer behavior, awareness generation, and the ability to understand what kind of a disaster this could lead into if you are not careful. Since we've been hearing about AMR and the kind of catastrophic response or the effects that it will have on the medical care and the clinical outcomes being compromised heavily because people are not responding to antibiotics, it is, I think, time that everybody joins the whole war against how to manage the whole pandemic of AMR, because everyone is saying that that's the next pandemic that's there looming in. And even though the best doctors and the best hospitals will be there, unless AMR is contained and there is good prescription practices, there is good antimicrobial stewardship, we will not get the desired clinical outcomes and people will still continue to die. There will be increased hospitalization, more number of hospital days within the hospital because patients are not responding to antibiotics. And I think everybody has a role to play within the community, within civil society, and all of us as citizens have a role to play. So today I have a fantastic panel sitting here with me, and we will now proceed forward to understand and hear from them, from their expertise and their background as to what kind of role each of us can play in managing the whole pandemic of AMR. And I would, in my world where I work as a patient advocate, we start the conversation by saying nothing about us without us. So the patient voice has to be at the center of everything that we do. So it's my pleasure to invite Manoj, who represents the patient voice very strongly, to share his views on what civil society patient organizations, patient advocates can do to contribute to managing this whole illness of AMR, and how can patient organizations like yours spread awareness within the community for rational use of antibiotics. So over to you, Manoj.
Doctor, I have a presentation. Can you?
Yeah, you can come here, I think.
Sorry to आप सबको डिस्टर्ब कर दिया. Okay, so two things before I start. डॉक्टर आपने ओपनिंग रिमार्क बोला, उसके पहले थोड़ा सा बात करता हूँ. नाउ आई रियलाइज कि मेरा फोटो मुझे अभी वाइट बाल के साथ लेना पड़ेगा. पुराना फोटो निकाल देना पड़ेगा. Okay. Or yesterday I attended the conference. It is a new subject for me basically, and the whole summary of yesterday, इसको मैं एक अच्छे से सॉन्ग में बोलना चाहता हूँ. दुनिया में कितना गम है, मेरा गम बहुत कम है. हमको ऐसा लगता था कि HIV की दुनिया ही हमारी दुनिया है, and like we used to feel that HIV is our world and so much wrong happening with us and all. And yesterday when I attended this, it's nothing. It's a small drop. There is a huge problems which each and every person is going through. And I really thank for calling me here and to make aware about this subject. Basically, it's a national coalition of people living with HIV in India. We started our journey when, we started our journey with 9 individuals in 1997, when shame, fear, guilt is very high. And HIV, nobody used to say HIV, it's a, आपको AIDS हो गया है. And that wording of AIDS हो गया है, the moment you hear that word, you will see the sukha hua peda, like a skeleton, and then you also feel that now you are also going to die. So we started from that, and then slowly, along with like good doctors, we also had a peer support mechanism where all the patients came together, and then we used to like kind of support to each other. How to maintain our CD4, how to maintain our health good. And that's had worked in our entire movement as from the patient perspective. We started from community mobilization. The first counseling which I received is you have 2 years. And then when we met another positive person, that person is saying, oh, I am living with HIV since last 9 years, 10 years. And that gives us so much courage and empowerment that, okay, my life will not end in 2 years. There is a more years. And that's how the whole community mobilization work started. Secondly, initially there was a big myths and misconception that these people are spreading the infection. And today I am really very proud that me and lots of people like us has limited virus within themselves. They haven't transmitted to anyone else. So we are a prevention agent. We told people that we can prevent it within oneself. We are healthy, we can live healthy life. And our role in going to society and telling that we are living with HIV, it means we are telling people, you take your own precaution. We are making them aware. And that's what we worked on 2 levels. We worked on reduction of stigma, discrimination. And we realized that our stories will motivate others to get tested and also to be safe, stay safe, and not to discriminate to anyone else. We did huge political advocacy. Like, we never missed any opportunity to contact any, even if it is Prime Minister or President. So the ARV came in India is a very sweet story, I must tell you. There was a IFCAI, International AIDS Vaccine Initiative, and Dr. Michael was in India, and the meeting was planned with Dr. Abdul Kalam. And in that meeting, 7 of us, along with Dr. Michael, and Shatrughan Sinha was that time the health minister. And we met Dr. Abdul Kalam. And then he is a doctor, but he is not from medical background. So he has very stupid questions like, what is CD4? But there is no cure. Then we explained him that there is a cure, there is a medicine, not cure, there is a medicine which prolongs the life. And then Shatrughan Sinha, when we came out, he said, I didn't realize that not 50 lakhs people require treatment. That time India was estimating 50 lakhs people. And only 2-3 lakh people were tested, and within that also only 60,000-70,000 was required. And he said, now I know that it's only for 60,000-70,000, we can work out something. And then treatment came. Sushma Swaraj announced that treatment. So the point here I want to mention that every level, advocacy from patient side is important. Second thing, along with political advocacy, we never miss chance to engage film personalities so that stigma will get reduced. We were just talking, and my colleague from previous experience of media engagement within HIV, which is now has gone down drastically. But that's how media also initially highlighted much about HIV, and that's how we are able to control in our country. We use double sword. One way we are advocating against the government, another way we are appreciating them for their good work. And that's how that combination of push and pull is working in HIV still, and that's how the government also thinks that HIV is one of the successful example where patient participation is very, very high. Now, as a people living with HIV and as a national network, we would like to offer, from whatever I'm hearing yesterday, we can help in mobilizing community, we can help in educating community, because demand generation, patients' rights, what is good for me, what is not good for me, that we must know. And when suppose I'm keep traveling, and sometimes I have to consult to the doctor who is unknown to me, and when I ask him which medicine you are giving to me, that person first look at me, who is this person? Why is asking this question to me? Then I have to explain him, like there are some drug-drug interaction, some medicines are not suitable for me, that is why I'm asking this question. And then they get comfort, and then they... So trying to say that the taking charge of oneself is important. And one of the things which I'm hearing from yesterday, where huge problems are there, and how best we can play our role in patient education or the overall awareness. And we are happy to play that role, and we are happy to associate with it. Thank you so much.
There in the pediatric age group, people do know and are aware, but there is also adult vaccination that can be given to prevent infectious diseases. However, except for a few vaccines, there isn't enough awareness on what to give for, say, life course vaccination for old age, people with age, and for vulnerable populations. So people who are on dialysis, people who are, have had transplants, people with low immune status need to have vaccinations. However, there isn't much awareness. So what role can media play in that particular area?
Thank you, Dr. Ratna Devi, for those two wonderful questions. Thank you to the organizers for organizing such a conference and putting together such a diverse panel. It needs to be, highlighted more, these issues. Now, before I go, I'll answer Dr. Ratna's queries by questions by just giving the audience an inside look into the media profession today. We were taught in media school that, the media is the medium, is the message, And I would like to say that the media is no different from society. It is part of society. It is the medium to the larger society. And therefore, I would invite, these topics are not being covered. One is perhaps one reason could be that, we don't have those transparent channels of information coming to us. Two is, if you look at who's getting into media today, okay, my mentor in media made me promise that I would teach the next generation, because people getting into science communication are very few and far between. So I take courses in science and health reporting at my alma mater, and I find that the people getting into journalism per se, today the batch sizes are shrinking. There are more people getting into the advertising and marketing courses because jobs are perceived to be there. You don't hear of, advertising agencies shutting down. However, you do hear of newsrooms shrinking, So parents also feel that if you're putting a child into advertising and marketing, job chances are good, etc., etc. Journalism is okay. Journalism has also become today about content writing rather than breaking news stories and journalism per se, the old style journalism. Field reporting has reduced because budgets have reduced. Everybody wants the glamour of a broadcast news reporting job, etc., etc. So the kind of people getting into, kind of students getting into journalism, I've noticed a huge change. And of course, COVID has really kind of, that whole generation of students who did their graduation in the COVID years, have lost the power of concentrating for a very long time, Attention spans have anyway decreased. And for reporting on health and science, you need a deeper, a longer attention span, because the topic is more technical. It needs an interest in it. It's not that it cannot be done. So my module of science and environment reporting, if it was an elective module, I would hardly have anybody coming to it, So, and this was not the case, say, 10 years ago, right? It was an elective module. I still had, out of a batch of, say, 60 students, I still had 25 students who would choose to take health and environmental reporting. Okay. Today, the batch has shrunk from, say, 60 to 40. And out of those 40, I know that there are hardly one or two journalists who will get, by choice, into health and environment reporting, because they see it as, ma'am, I've done arts, so I don't think that I can report on this. I find it too technical. And since I come from Mumbai, so my alma mater is in Mumbai, everybody wants to do, what beat do they want the best? Bollywood beat, okay? Entertainment, lifestyle. And I tell them that, and financial reporting, because Mumbai is, this is. So I tell them that health is everything. Health is lifestyle, okay? Health is financial reporting. Health is also Bollywood reporting, because come on, Bollywood stars don't fall ill, okay? They do, right? So you do one beat and you can report on so many different aspects of it. So, of course, I'm trivializing the issue a bit, but, shock sells, okay? That's okay. The talent coming into the journalism industry. Now, I'm not trying to make excuses, but I'm just trying to sensitize the medical and clinical community to the kind of talent that is coming into the health communicators profession as a whole. Okay, and one would have thought that during COVID, a lot of journalists became health journalists because that was the only news story going around, right? You had to break stories, and health stories were the only stories that were being broken. So everybody became till that time, everybody thought API was an IT term. No, afterwards we came to know that it's active pharmaceutical ingredient. Otherwise it was only used in IT stories. And I don't know what the full form is in IT, but it's application something. Okay, Hyderabad people would know that since this is Cyberabad. So everybody became a health reporter, which was a good thing. Lots of stories were being broken, but misreported. Because they did not have a background and they did not have the time to go to the right people to get the right information. So let's learn from COVID and create those channels of communication. Transparent communication, accurate communication, right? So my solution to that, and I believe health journalism and health writing is not just pointing out the challenges, but it's solution journalism. There's a brand of journalism called solution-based journalism. So you state the problem, but also offer the solution. So my solution to that is more conferences like this, where more media people are asked to attend, which becomes an opportunity to network, get in touch with people, build contacts, absorb, listen, learn what is happening on stage. I've put a LinkedIn post and said lots of interesting discussions, both on and off stage, because that's where you kind of go more in depth. And also encourage people from the fraternity, from the clinical fraternity, from the student fraternity here, to start writing, to write into us. We do carry, a lot of articles on it. Okay, now I come from what is called a trade media or a specialist media. I'm not breaking news, okay? I don't do news, I do analysis, okay? So I'm not fighting for eyeballs. I don't need those sticky eyeballs, because I know that the people who want information will come to me. And since my 2 publications go online real time, and all our stories are there, no paywall, etc., etc. So I know that even though our target audience, and we don't write specifically for the lay community of patients, I know that patients do read us, and everybody is reading us, both nationally and globally. Right? There are a lot of mainline communication, publications who are behind a paywall. And I feel that paywall is, of course, business makes, you need to make money for the business part of it. But I think that that's also a disservice. So you need to have some kind of balance on that. Probably you keep it so that everybody can read it for, 2 days, and then you put it behind a paywall, or after 5 days, take off the paywall or something like that, So some kind of business, model needs to be worked on that. So let me have a look at my points to see whether I've covered, it. Yeah. So nurture, educate journalists, start young. We were in Dr. Abdul's, Abdul Ghafoor's panel in the morning, and he said entrepreneurships start them young, because then you can mold them. So start nurturing the young journalists in journalism school as they come out, etc., etc. News stories have to be new. So, don't expect the same story to be covered again and again. Add something new to the story if you're a source for that story. Lack of transparency leads to mistrust and misinformation. So for heaven's sake, if a journalist gets to you, please don't try to, lead him away and dumb down the story for him, because he will sniff out something, and then, it's going to be even worse. So go to him with all the facts. 2 is role of the media, I would say, depends on what society allows us to do. Okay, so we can either be a lapdog, or a watchdog, or a guard dog. Muzzle us and society suffers. Right? Business goes on probably, but society suffers. So whistleblowers come to us. We do cover their stories after checking it out, but when we go to check out, we're muzzled. So those are the kind of stories which, those are my points, and I hope I have answered some of the, questions which you put up in a roundabout way. But Those are my points which I jotted down. I hope I weaved that into the 2 questions that you asked me. Thank you.
Thank you. I do have some follow-up questions, but I will hold them until we have finished with all the speakers. So from the journalistic aspect of it, and why we need journals as our journalists as our friends and as people who support us, we have another section of the society that is not really included in conversations around AMR, but are very deep influencers, because that is the first point of contact for any patient, which is the pharmacist or the pharmacy. And we all know that in the context of our country, going to a doctor is time-taking, is resource-intensive. So most often, if you have a fever, you will end up at a pharmacy instead of going to the doctor. And therefore, the pharmacists have a very large influence that they can have on consumer behavior. So my question to you, Madam, is how can pharmacy associations, whether globally or within the context of our country, and especially the community pharmacists, give the right messaging to curb the menace of AMR, and what can be done more to include this community into mainstream dialogue, so that patients who are reaching a pharmacy get the right information, are able to take the right antibiotics and complete a course, because that's another very big problem. They take the antibiotics and they do not complete the course, and doctors do not have enough time to explain about the antibiotics, whereas we can use these human resources in a very productive way. So what can be done? Some ideas from your side.
Yes, thank you. Am I audible? Yeah. Yes. So thanks for this very nice question, and thanks to organizers for including pharmacy. And I hope this grows further in next conferences. I'm representing International Pharmaceutical Federation, which is the home for the global pharmacy profession. I just finished my term as Vice President, but I'm with FIP and representing FIP here. As Dr. Ratna Devi rightly said, pharmacists are the first point of contact. Let me tell you, United Nations has said the 4 pillars of the health system are the doctors, nurses, dentist, and a pharmacist. Also, if you're measuring the progress of the country towards the Sustainable Development Goal number 3, one of the indicators is the pharmacist density in the country. And so pharmacists are considered as healthcare professionals globally, but in our country, the community pharmacists, whom we call as medical wala, chemist, retail pharmacist, their role is not yet evolved as a healthcare professional. And as an association at an international level, and at Indian Pharmaceutical Association, we are trying best to strengthen the role of the pharmacist by training and education, as well as by doing the advocacy with the government, because we need a right ecosystem for the pharmacist to work, as well as consumer education. And I can supplement something that what Madam Viveka has said, that people like us, people who are professionals, need to write in the daily newspapers to influence the consumer behavior. And I have been writing columns in Marathi newspapers on the medicine usage, and they have been quite popular, I can say humbly, and there are a lot of queries coming from the consumers. So we need to write in simple language. I know that is your area, but we try to learn to write in simple language, and then that works. So that is very important, that media should understand and invite the people, at least the daily media I'm saying, not journals like her. So that is a part. Now what pharmacists can do, so there is a wrong use, underuse and overuse of the antibiotics, all antimicrobials including antifungals, not just the antibiotics, very common. And pharmacists being first point of contact, the pharmacists they're in a strategic position, because people like having fever, cold, they first come to the counter and ask for some medicines. So here is the role of the pharmacist, telling them about what should be done, what should not be done. So do not take antibiotics for the viral infections like common cold. That is one of the first things that the pharmacists need to do, and we try to educate the pharmacists for the same. Or do not give antibiotics without prescription, at least not the high-end antibiotics without prescription, but there should be an algorithm developed in our country, what exactly would be the limits for the role of the pharmacist, and when the patient should be referred to to the physicians. So we need to strengthen the role by developing these kind of, frameworks for the pharmacists, and that effort has been going on. And when the patient comes with the prescription, there is a role of the pharmacist to counsel the patient that to complete the course of the antibiotics or do not miss any single dose. Or there could be some side effects like, stomach upset. Patients get really scared with the stomach upset, or some side effect like rifampicin has dark color of the urine, the red color of the urine. And then some patients of TB have left the course just because they felt that they are bleeding. So here is the role of pharmacists influencing the patient, making them understand what the antibiotic does and why they should not be leaving it halfway and come back to them, or go back to physicians if there are serious concerns. So this is a very important role of pharmacists, as well as pharmacists has a role in prevention by creating community awareness for the infection prevention and control practices, and also on the vaccination. In fact, FIP and IPA, we both are advocating the role of the pharmacist as vaccinators and as vaccine advocates, even for life course immunization. So I think prevention, community awareness, counseling of the patients, that is all very important, and so that will help in the rational use of antimicrobials. So pharmacists are the key stakeholders in AMR as well as overall in the healthcare. And we need to strengthen their role. They're trying to do their role, but our education as well as the training needs to be improved, as well as the government policies need to be modulated so that the pharmacists can work as true healthcare professional, and they can work as antibiotic stewards and antibiotic guardians. That's what we foresee in the future that should happen in case of the pharmacist. Thank you.
Thank you, madam. Just wanted to add one more thing.
AMR and foster AMS. So the project is on, and I'm sure it will grow further in the future. Thank you.
Thank you. Thank you so much. And then I will come to Dr. Somdatta, and you call yourself something called superheroes against superbugs. So the superbugs we've been hearing since 3 days, but we would like to hear a little more about the superheroes and how scientists like yourself are actually connecting with community and bridging the gap, so that usually you see the scientist in a lab working in a little corner in a very sterilized environment. And what happens in the lab is not known to the community. But you are bridging that gap and bringing that information out of the lab so that the community is empowered to take responsible actions. So how do you do this, and what is this whole initiative of superheroes against superbugs?
Sure. Thank you very much for the question, and also heartfelt thanks for bringing together experts from various different aspects of public engagement on AMR together. So Superheroes Against Superbugs was actually co-founded by Ponnari and Sarah, and I joined them from the first time that we started working with school students, because the idea was to engage young people, inform them about a problem called as AMR, and use them as partners to go and influence their parents. That was the very humble aim that we had. And schools happened to be the easiest way for us to reach out to them, because we could connect this with the little bit of microbes that they study in their curriculum. And what we saw is that schools are interested in this because this helps students learn a little bit of biology better. But at the end of the day, it's a very technical subject. I mean, we are going much far beyond what the textbooks really talk about, and the importance of connecting the dots via different hands-on activities helps. And we actually ended up creating a forum where scientists could now come and talk about what they do in the labs. So Sarah, Ponnari and I mean, we are all trained in biology. We are all molecular biologists by training. And then we ended up working in different aspects of science communication or public engagement or research management. And our core expertise is actually to build these forums. And once these forums are built, we found many scientists who work on AMR directly or indirectly to actually appreciate having those forums and going and talking to students. So one aspect was building the forums. Two is thinking about how to have these conversations with children which is what we started with, and later on a lot of people who wanted to fund us wanted us to work with medical students or pharmacy students. So young people is still the remit that we are working on, but different kinds of young people. And each time we have to think about how do we make the technical complexity of AMR understandable to them. And we do that through arts, through various hands-on activities. And we also realized one thing that we really miss on is finding human stories of AMR. AMR largely remains numbers, and people say, of course, there are millions of people, but I'm not one of those millions. And that is something where I feel that the medical community has a huge role to play, because even if people suffer a lot and sometimes even die due to AMR, we never realize that it's because of AMR. We think it's a cardiac arrest that actually costed that life. So that's one aspect that we have realized, that we need more of those stories. And we hope that one day media will be able to cover those more. We tried connecting, because particularly Sarah and my role have been in very close connect with the journalist community also. But the journalist community says that unless there is something new happening, we cannot be talking about just the same old thing that, okay, there are so many cases of AMR. And it seems like nothing new is happening because the medical community is not talking about what are those new things, and or if a Bollywood star is actually infected by AMR. Yeah, so we need those connections to be built, and new doesn't need to be like a huge whole report coming out, which of course gets covered, but how it is really impacting individuals, and that's one aspect that we have seen a huge lacuna in. In our own capacity, what we do is, for example, Ponnari has a lot of connect with the medical community, and we have started now to reach out to these physicians, clinicians ourselves, and ask them for these stories of their patients if they are willing to share with us, and we are trying to bring out those. Ours is a very small initiative, and we are only trying to set these as examples, and we are hoping that, and what seems very promising is that the medical students that we have reached out to, which actually happened just serendipitously for us, are actually connecting with this problem, and they want to be taking this forward from us. And we hope that the formats that we have developed, the resources and the resource person list that we have with us now, will be taken ahead by the bigger community. And another thing that we learned from these young medical students is that they also want to learn how to have the communication with the patients who are suffering from AMR infections. How do you even tell them that, okay, you are suffering from something that we are not, we don't have something to treat you very well, very effectively right now. And these, we all understand, are extremely complex conversations to have with patients, and the medical community needs to take cognizance of that and have those deliberations more actively. And similarly, we have seen, when we have worked a little bit with the pharmacy students also, definitely not as much as what you do, but we see that the pharmacy students also realize once they understand the science behind it, what is causing this and the gravity of this, they want to at least have posters in their pharmacy counters saying that, okay, if you are given an antibiotic, you should be using it appropriately. And India, of course, is an extremely diverse country. I remember from my own childhood days, the doctor that we used to go to, a trusted doctor, would give us some colored pills. We never knew what is being given to us. And from there, of course, there's now, in the urban setup that I am in now, I see people understanding that they take antibiotics but don't know what to do about it. And it could be the pharmacist, it could be the medical doctor who has to inform the patient that there is a special medicine in this concoction that you're being given called antibiotics, and they have to be treated with certain amount of responsibility. So yeah, that's what we are trying to do.
Thank you. Thank you so much. And you said something about each one of us doing, a lot of good work. And I would like to thank Dr. Ponnari, because it was her brainchild to have this particular session. And she's the one who led the whole thing, brought me in, and then we could connect with all of you. So a few words from Dr. Ponnari. And
Thank you, Dr. Ratna. No, thank you also for coming forward to to put together such a great panel. And even at this conference, I think I realized that there are one thing that we keep saying at Superheroes Against Superbugs is that everyone has a role to play in combating AMR. But again, there are very, very few platforms, I think, that brings together these different voices and these different perspectives. So I think, working on AMR for the past 5 years, communicating about AMR in the past 5 years, I think there are many, many challenges, in this area. One, because the problem itself is so complex. The science is complex, but then the problem also, it's so multi-sectorial. There are so many contributing factors. So it is not one particular area or one particular sector. So one challenge that I think we all face while working with communities is not just simplifying the problem for them, but also to strike that balance between sort of urgency and not overwhelming them with the problem, because we do want to tell them about the One Health concept. We do want to tell them that there are so many, the pharma companies play a role, the hospitals play a role, there's environmental pollution, there's climate change, there's so many different things affecting this. But at the same time, we don't want to overwhelm them so they think that, oh, this is so beyond us. There's so much, what can we do about it? There's nothing we can do about it. So I think it's also very important to strike that balance and also leave everybody that we talk with some key actionable takeaways, that they themselves will be able to act on. And I think that is a challenge that I would, that all of us panelists need to, think about. And also how, like Somdatta rightly pointed out, ours is such a diverse country, so many social contexts, cultural contexts. How do we make this messaging, culturally relevant? How do we make this reach different diverse social contexts and make it relevant to them? So, thank you.
Just to continue from your picking up on one point which you said, well, it's so diverse, it sometimes overwhelms you and you don't know where to start, because, and also when you create a sense of urgency, then people say, oh, it's so big that, this. So we was just speaking, Dr. Manjiri and myself, last night with Dr. Ghaffur, and he said that, when I started on this journey of AMR, there was a whole list of, antibiotics that needed to be banned, and I said that that's never going to work. So he focused on one antibiotic, colistin, and that worked, because then he was able to rally around that one thing, and that became his rallying cry. And then the government also understood it, and of course there were other factors which also played into it, but focus on one part, but you have to choose that part right. I suppose that's the tricky part also.
To answer your question, Doctor, I'm just thinking how we can play this, that role we can play, and we'll be happy to jointly work with.
Thank you. We already have a commitment, and in fact, I was just coming to the concluding remarks and trying to get.
I'll add. So the World Antimicrobial Resistance Awareness Week is coming in November, 3rd week. So that is the right time if you want to craft some messages and float it around to 2 million people here and through the pharmacist to millions of people. So we'll be happy to do that. We already have a lot of educational material through the pharmacists for the consumers, but we can make something new with all the minds here, and then we can make a beginning there in the World WAAAW. Yeah, November.
Yeah, World Antibiotic Awareness Week. It's called WOW. And yeah,
now it is antimicrobial, and now it is antimicrobial resistance awareness
7
week.
to 14
So
November,
emphasizing more on the resistance part.
So thank you so much. I think 2 or 3 of them have already given their concluding remarks. So I will just try and wrap it up by saying each one of us has a very important, very critical role to play. And I think the bottom line is that collaboration is the key, because each one is doing something, but we don't know what the other person is doing. So how do we share what each one of us is doing, and how do we bring this all into a collective so that there is higher impact? And as Manoj said, he has a cohort of 2 million. I'm sure you have more than a few millions. you have a membership of a few millions. We have patient organizations, and you have a connect with the doctors community. So, and we can start with the November Awareness Week as an initial step towards creating awareness, have common messaging, and see how it goes. And my follow-up question that I had left, because we were running out of time, is social media is a very powerful tool. And the goodness or the badness of social media is that if there is common messaging, then it trends. Instead of each one putting their own message. So we can use that as a very powerful tool. And I do know that journalists use social media to advantage, and we can take some lessons from them on how to use social media to advantage. And if there can be a collaborative that comes out of it, where all of these organizations can join together and maybe work with you on the superheroes, so all of us can be superheroes against the superbugs, if you can allow us that kind of designation, and have some kind of a collaborative between all the organizations so that we can work towards awareness generation and better prescription as well as better consumer behavior, and add to the initiatives that are being taken by the government, by a lot of bilateral and other UN agencies, as well as by the Government of India, Ministry of Health and Family Welfare, and add to whatever is being done so that the general population becomes more responsible, and the consumption of antibiotics reduces to only people who actually need it and deserve it, and not taking it randomly just because you're not feeling well. So I'll stop there, and I hope I finished on time because I did not get a slip. So thank you, everyone, and I think